Welcome and thanks for joining me today. I'm Teresa Paulette, the project coordinator for the Stoughton Wellness Coalition, and I'm going to talk to you a little bit about how you can help prevent youth substance misuse among our students 18 and under in the Stoughton community. The Stoughton Wellness Coalition is a broad collaborative of multiple organizations across the community, sponsored by Stoughton Health through a grant from the CDC. Our main focus areas for this grant are underage drinking, prescription drug misuse, and vaping. And I'll be sharing a little bit about each of those categories and some of the work that's happening in the community currently and how you can be involved. The coalition's main focus is that engaging community members to solve local problems is a research-based approach to actually reducing youth substance and making a healthier community overall. We do this through a variety of strategies. We have 7 strategies that we use for community change, and I'll be getting into those a little bit more as we move along. But the key focus is providing information through regular media, newspapers, handouts, print materials and brochures, billboards, things like that that you see around the community. Enhancing skills is our second piece, which means providing training to change the way we actually do the work around preventing youth substance and incorporating evidence-based and research-based strategies. We change physical design, and this includes using yard signs and billboards and lighting and possibly signage in parks that you will see that reflect our ordinances around open intoxicants and smoking and vaping in our clear air ordinances. We provide a lot of support to ongoing activities for youth, funding, resources, and materials. And we also are active in ways of reducing barriers and promoting access to healthy activities. We also work on changing consequences, such as if a student is given an underage drinking ticket, what sorts of things happen as a consequence to that, our alcohol age compliance checks, and other things that have a result in a more positive outcome for both youth and the community. And we also are working heavily to change policies in city government around strengthening our alcohol policies that then limit access in the community for youth. So I'll talk a little bit about some of our data. We follow a lot of data collection in our decision-making around the work that we do at the coalition. And during COVID, we saw some really dramatic changes in our data. And most of our data points around youth substance and alcohol and adult youth also really declined in terms of our data collection services. We know in-home use increased pretty dramatically during that time frame as people were ordering online and also picking up outside of liquor stores and grocery stores as a new trend. And even though our data declined pretty dramatically around youth use, we're still in Stoughton higher than Dane County and national averages for both underage drinking and use of vape devices. So our first challenge that we're getting at is underage drinking. And in Wisconsin, the culture of alcohol is one of the strongest in the country. So we know that the 2 areas that we need to address based on our data is how youth access alcohol in the community and where it's available to them. And so from our data, we've learned that many youth are able to purchase alcohol themselves at local retailers. And also they are able to access it at home. And our most recent data indicates that 38% of our youth at Stoughton High School who report drinking alcohol are reporting that they are getting it directly from their own parents. And this is a different trend than we've seen in the past and probably a result of the COVID pandemic and youth being at home more than they were in the past. So a couple of strategies that we use for this is actually we pay the Stoughton Police Department time to do alcohol compliance checks. And this is a process where youth under the age of 21 go into a retailer and attempt to purchase alcohol. All retailers in Stoughton are contacted in advance. They receive a letter letting them know that this is going to be happening. The key points in how to correctly check IDs for minors and how to train your staff to do the same. And they're indicated that it'll be happening in the next 2 to 4 weeks typically. So they have a definite heads up that this is going to be happening. When the youth comes into the establishment, they actually use their own ID if it's asked for. They answer any questions honestly. There is no falsification or sort of trickery that goes on. It's just a very clear, plain approach to buying alcohol. If their purchase goes through and the retailer actually sells alcohol to them, then the retailer receives a citation from the police department. These compliance checks are done usually a couple of times a year. So that we can maintain good information from our retailers, and they also receive additional education after the citation on preventing this from happening in the future. We also use signage in yards and around school buildings to alert families about talking to your kids about alcohol, and these include websites at the bottom that direct families and parents to good information from the state of Wisconsin and the Small Talks campaign. And then one other strategy that we use around underage drinking prevention is we actually give away refrigerator magnets that are locks. And so you would put this on either side of your refrigerator, and it has a little padlock that goes on it. And even if it gets pried off by a screwdriver from the youth in your house, you will know that someone has accessed the alcohol that you were trying to protect. The second area of focus for the coalition's work is prescription drug misuse. And because of the opioid crisis and a lot of the national awareness campaigns that we were able to tag onto, the data here in Stoughton shows that our youth underage 18 have dramatically decreased their use of prescription drugs. In 2016, when we began this initiative, our data indicated almost 10% of our high school age students were using prescription drugs that did not belong to them. Our 2021 data now indicates that we're just over 2%. And in focus groups at the high school, most of the students weren't even familiar with the possibility of using someone else's prescription drugs. And we're very excited about sharing that piece of progress as it's gone across the state, but also here in Stoughton. A couple of strategies that we will continue to engage in based on the overdose epidemic now happening are the same as what we've used with youth. And an important piece to consider with this is the percentage of overdose deaths that are happening in people under 21 is very, very low in terms of prescription drugs and opioids. But we know that it's very high in the age group above that. And so we continue to provide community information and support to reduce access in general, even though we know that our youth are not as likely to be using these substances. So one of the classic pieces that folks are familiar with here in Stoughton is the medication disposal and sharps collection events that we hold in partnership with the Stoughton Fire Department and Stoughton Police Department. These events happen twice annually. Typically, it's the last Saturday in April, which is coming up on April 30th in a few weeks, and the last Saturday in October. This is a drive-through event. We open 2 of the bays at the fire station, and people are able to drive through, hand their unwanted medications, and also use sharps right out the window of their car and not even get out. In some cases, folks even open their trunk and have us unload larger quantities of unwanted medication and prescription drugs, and we are able to get them disposed of through the state DEA take-back process, along with many other communities in Wisconsin. Another piece that we use with this, in addition to getting rid of unwanted medications in your house, if you do have medications that you need to keep for a longer term or ongoing, we give away locking devices to help people safely store those medications at home. So one example of that is a zipping bag. This has both a combination lock and a backup key. and is also great for traveling if you're doing that kind of thing. And we also have a couple of variations of medication lock boxes that folks can use at home. And these have a combination lock with them and are great for larger quantities of medications. One other opportunity that we have if a take-back event isn't going to fit your schedule is that we have a medication drop box at the Stoughton Police Department that is available 24/7. There's actually 2 boxes there. You can drop off medications safely in these drop boxes anytime, and they are disposed of by the police department at our annual events. They're stored in the police department in between times. Our first event following the COVID shutdown was a year ago right now, and we had over 800 pounds of medications from those drop boxes at the police department alone that people had been disposing of throughout the shutdown when we weren't able to hold events. So we're very excited that those boxes are being used to get those medications out of the house. So in the PowerPoint, I have a slide that shows the increases of our medication collections over the past 4 years, and you'll see a dramatic increase, especially in the last 2 years. That is very exciting, and we're happy to be able to share that information. The third issue of focus for the coalition is underage tobacco use, mainly through the mechanism of vape devices. This is a trend that began to pop up in 2017. And most of us in the healthcare and public health world were completely unfamiliar with this new approach to nicotine use until it had rapidly spread. Some focus groups were done in another part of Dane County where students said, no, we don't smoke, we juul and we vape. And it was sort of dumbfounding because we hadn't seen that in any data collection and we hadn't heard of it among students, and within months it had spread like wildfire across our communities. Some key points I want to make about the dangers of vaping include the juices and flavoring that are used in common vape devices. In addition to nicotine and potentially THC, the juices are made from a variety of incredibly toxic chemicals, including some of the same components you find in Roundup herbicide, in nail polish remover, in heat antifreeze, and in some components actually of fireworks and other explosives, in addition to nicotine. The nicotine component in the common vape devices is incredibly high. I'm going to show you a juul. This is the most common vape device used among youth currently. This little tiny cartridge right here is where the juices are held. This is heated up on a mechanism that actually plugs in to your computer. It looks like a USB, and it has a magnet actually on it to help it guide itself into that charging device. This tiny little cartridge holds as much nicotine as an entire pack of cigarettes. And it's important to know that many youth are using multiple cartridges a day, which equates to vaping multiple packs of cigarettes. And the nicotine impact of that obviously is very, very large. The chemical components combination that is really critical to understand is that this is not water vapor being consumed. And this is one of the largest misconceptions of vaping, is that we're just bringing in water vapor. It's herbal, it's harmless. And in some cases, initially people didn't even know there was nicotine involved. But what we're actually breathing in is an aerosol. And these combinations of separate chemicals, and I highlighted some of the most toxic that we know of, then combine to create an additional chemical compound of some sort that we don't even know what it is because this isn't FDA regulated. And then that compound is heated up, which we also know changes the chemistry of that compound. So the actual component that's being inhaled is pretty unknown, but contains known carcinogens that are very dangerous to our bodies. The other part about the difference between water vapor and aerosol is water vapor does dissipate and dissolve, and aerosol does not. And one of my favorite ways of explaining how this works is an exercise I use in a presentation for 9th grade health classes. We actually have the students spray tissues with water from a water spray bottle. And then we have them spray tissues with aerosol from a hairspray bottle. And we let those dry for a few minutes while we're doing some other activities. And then we go back and revisit those tissues. And as you might imagine, the water vapor has dissipated and dried, and the tissue is almost exactly the same as it was before we sprayed it. The aerosol has also dried, and it is sort of crunchy, kind of like hairspray on your hair. And it's important to know that when this is breathed into the lungs, it does not dissipate. It coats the center of the lungs, and it doesn't ever go away. And the more that's repeated, the more damage is done to the lungs. And this is dangerous for any age group, but especially for youth, as their bodies are still growing, and that this leads to potential other significant health issues that we've begun to see all over the country. Regardless of COVID, which is another piece that we'll be watching in the future. So I wanted to spend a few minutes and show you some of the more common devices and components that some of our youth are using. The coalition hosts an event called a Hidden in Plain Sight Room. And this room is actually a mock bedroom that was actually researched and built by Stoughton EMS. And it contains 26 items that are hiding components for drug and alcohol or other paraphernalia that can commonly be found in the bedroom of a high schooler or middle schooler. This particular approach is not about being hypervigilant and searching through your student's room on a regular basis. We don't want to violate privacy for no reason, and that can also really affect the parent-child relationship ongoing. But if you have concerns, we have some key points on how to have those conversations with your youth, and then also things that you might look for or ask them about. So one of our favorite simple pieces are any kind of soda, energy drink, or even water bottles that disguise substance use. So if this jar or can of green tea has been sitting on your student's desk in their room for a couple of weeks and doesn't seem to ever get empty, you might think about it having a little different use. This one has a top that screws off and leaves you with a compartment in the middle. This one we have fake marijuana in here, but it's plenty of room. The entire length of this canister is hollowed out and easy to disguise other items that might be in there. Another common one is this is a deodorant, and again, this actually has an opening, and this one is a flask. So this could be put in a sports bag. It could be on the bus on the way to a football game. It could be in lots of different places or sitting on the dresser in your child's bedroom. This is an actual working power strip. When I plug it in, the light comes on, but in the back, it has a component that opens up, and again, easy place to put items and hide them. Looks like a basic pack of gum. And again, this particular pack has a box that pops off. Whoop. And here we have some, I think we've got pretend heroin in here, something like that. But again, easy to keep in a purse, easy to keep in a bag, or sitting on the dresser. A couple of pieces specific to vaping that I want to help people be aware of. This beautiful little piece of art here is actually called a Soren drop. It is a vape device. It has a tiny little port on the bottom to charge, and also plugs into your USB port. And on the top, it pops off, and we have a refillable cartridge where you would buy the little juice containers and refill it instead of using a disposable cartridge. This one is refillable by using juices with a specific port on the top. This piece here has been a common trendy piece of jewelry. Many youth actually have kits to make these and give them away to their friends. This particular one is a pot pipe. So it screws apart. We have our little space to inhale, and we have our little pipe right there, and can easily be stashed with everybody else's jewelry. And there are products coming on the market all the time. This is one of my most recent finds. This is a watch. Looks very much like the watch I'm holding. It charges exactly like the watch I'm holding. And it has the date and time and all of that like a regular watch. The difference on this one is that it has a little button on the side that allows the top to pop off. Whew, if I can get it off. Yep. And here we have a refillable vape device also. And this one also uses the juices, and they just have a port on the top of the juice bottle that allows you to fill up again. These are a little larger than the Juul pods, so expectation of more nicotine if that is what they're choosing to vape from it. If you'd like more information about the work of the Coalition, feel free to visit our website, which is stoughtonwellness.org, or follow us on Facebook, and look for our events coming up in the near future. Thanks for taking the time to watch this presentation.